leg. So if your leg's broken, you would go to a doctor and other health caregivers, and a team of people would take care of you. And you could get tests and treatment and things for healing, and there'd be a definition of what is wrong, what should happen, how do we fix this, and what to expect. And if the doctor says we're going to set this bone and it's going to hurt for a minute while we do it, and there'll be some bumps in the road, but then it'll be better so Johnny can walk, in 6 weeks or something, then that's kind of the description. And here's this pain medicine, the side effect is throwing up, and it usually doesn't happen, but if it does, call me and we'll do something else. It's typical roll up your sleeves medical care, and we think that that's what's helpful for children. And obviously it's very complicated because autism from a biomedical standpoint is complicated. So because I'm a believer in everything, and because when I go to restaurants I order the variety plate, I wanted to talk about as many things as possible. And so I wanted to talk about 100 things, but it was limited to just a few. So we're going to talk about the immune system, okay, and several things that relate to it, and treatments in that category, as you can see on that sort of top paragraph up there on my first slide. And then we're going to talk about transdermal DMSA as a treatment for autism, okay? So let's get started. And what we're going to do is go through this, and I'm going to buzz through this, okay? If you've ever seen me on the rare times when I get a chance to cut my grass or something, because it always grows in between me not having time to do it, then I get on the riding mower with my son, he puts the earphones on, and we go at 100 miles an hour. He has a laugh a minute, and then we buzz through it, and then we do a rehash. He had fun on this turn, we missed that spot over there, and so that's what I'm going to do because we have so much to talk about. Don't get overwhelmed because we want to have time at the second half of the discussion here today for two reasons. Angie is going to get up, and she'll make some comments as we go along where appropriate. She's going to get up and make a discussion about transdermal DMSA and show you the recovery video of her son Joshua, okay? And so I think that, and then we want to hear you. We want to hear what you have to say and discussions and comments and things like that, okay? So don't get overwhelmed. I know you already are. All right, what about Actos? How many people have heard about Actos in the treatment of the immune system for autism? Not too many, okay? Actos is a medication that's called a glitazone, and glitazones, there's two of them in the United States, and one of them was in the news recently, Avandia, and we'll talk about that too because I think it's very important. They are used for diabetes, which means that's what they're approved for. We use it for the immune system in children, okay? It's been used in the immune system for adults and children for about 5 years for a variety of immunologic disorders because it makes the immune system better. So when the immune system is causing the problem or leading to the symptoms or the sickness, okay, that your child has, then the glitazones can help, okay? So Actos has been researched by a gentleman named Marvin Boris in Long Island with his group. There are 3 practitioners in that group. And we're also using a lot of it. I would say between the 4 practitioners in those 2 practices, we have more experience than anyone else in the world, and I think we've got as many patients per practitioner as they do. And so we have lots of experience with it, and we're getting more experience all the time. Now, it was first used for MS, multiple sclerosis, which is a neurologic disease where brain and nerve problems occur. And you can just see how a diabetic with MS would accidentally sort of, if you will, be on this medication for diabetes and happen to have MS. And if the MS got better, the doctor or the patient might say, hey, my immune system sort of is better. Now, what would the immune system have to do with MS? Myself and many other people, we believe, along with others, that many of the cases of MS have autoimmunity, where the immune system attacks the patient. And so that's where it was first used, okay? Now, what do glitazones do, okay? For diabetes, they take care of metabolism and muscle and pancreas and all that. If you think of other parts of the body where these drugs go, they do whatever they do in different organs. So think about the effects that medications have throughout your whole body. When you take Motrin for a headache, it goes down to your left toe, too, okay? So if next week you bumped your toe or something, then it can help the pain down there. So drugs go throughout your whole body for the most part, and they have effects. It's just that we don't think of them that way, okay? So what happens when you think about the white blood cells in your body? These are the soldiers, the generals, and all the pieces that run your immune system, right? Okay? So if you think about what happens in your immune system, we can break it down to lymphocytes. Lymphocytes are the generals of your immune system, and there's the T lymphocytes, okay? These run all the other white blood cells and tell them what to do. There's a balance between T helper cells, and there's 2 groups, Th1, T helper 1, and Th2. And the Th2 helps us to have an itchy trigger finger, okay? So if you're a security guard at a place where, you're supposed to be able to defend, when burglars break in, you're supposed to sort of decide to stop them, and if they don't stop, you tell them you got to stop, and you tell them you're going to call the police. And if they don't stop and they're dangerous, you might have to have a mechanism by which you pull out a gun or pull out a baton or something, and that's the itchy trigger finger. TH2 is the gun with the itchy trigger finger. If there's too much TH2, you get too much firing. You get autoimmunity. What's that? That's a civil war in your body where you turn on yourself. Your immune system shoots at you. Okay? We don't want that to happen. You get allergy, and what's that? That's friendly fire, all right, where you're shooting at the birds, but you're shooting at the trees, and you're shooting at rocks, and you're shooting at the grass. You shouldn't do that. You should shoot at targets and not get all this background noise, okay? And then you also don't shoot at the bad guys if you have too much TH2. So we want more of the TH1 is what this amounts to, okay? If you don't have the right balance, what happens? Look down this list, okay? This is what affects our kids, right? Brain, what's that? Language, meltdowns, things like that. Nerves, what's that? Sensory integration, too high or too low, a threshold for pain. Funny taste and texture issues in the mouth, this kind of thing. The GI tract, need we say more? Constipation, diarrhea, yeast, all kinds of bad bacteria, so on and so forth. Do our kids get respiratory infections, sinus and lung infections, bronchitis, allergies there? Yes, okay. I have many patients, and it's near and dear to my heart. My son has hypothyroidism. The immune system destroyed his thyroid before I started learning more about how these things work. So we, know that happened in his case, and we have several patients in our practice. And you can see these other issues, frequent infections, and then other situations other than autism, such as fibromyalgia, OCD. We'll talk about those. Allergy is a big thing. Some of our kids can't eat anything. They're allergic to everything, and everything they breathe, dust and whatever. Okay? So if we keep going a little bit, what are the manifestations of these problems in these different body areas? OCD, actually, somebody I heard the last lecture talking about testing for strep infections and autoimmunity, okay? OCD is often caused by strep and respiratory germs where the immune system's triggered in that wrong direction and makes you get OCD-ish, compulsive and repetitive and so on and so forth. Tics is very closely related to that. Autoimmunity, allergy, which connects to asthma. Reactive attachment, again, near and dear to my heart. We have many adoptive children in our practice. Oh, hi, we got some of the quiet adoptive parents over there. They're very shy. They need to warm up a little bit, okay? Just give them a little time. They're just like any other parents. They're aware that biomedicine is one of the approaches for kids with reactive attachment disorder. So we have these issues that are immunologic. Just ask those parents over there, okay? And they will tell you it's been a big part of their kids' issues in recovery. Autistic colitis. If you heard Andy Wakefield, how many people heard Andy Wakefield talk? This is an autoimmune disorder attacking your own digestive system, okay? And then all kinds of blood tests that are abnormal. And parents and siblings and other people often can get sick, okay? What does Actos do when it gets inside the white blood cells? Not for, thinking about it as a diabetic drug. It shifts back to TH1. It's through a process called apoptosis, which is where the white blood cells that are the bosses tell some of the white blood cells, you're done, your life is over, and so those cells that go attacking the wrong things the wrong way die off. And the extra ones that do the right thing, it's like weeding out the bad cops in your police department now. Everybody can go after the bad guys and not, corrupt things and so on. And the goal is among several things here, which is the new slide I have up there. You want to improve things like the GI tract, leaky gut, dysbiosis. These are things where the gut is too permeable, lets toxins in, lets yeast grow, all that kind of thing. And frequent infections. Many of our kids, not everybody, many of them get very, very sick all the time. A cold takes them 2 or 3 weeks to get over, maybe 6 weeks, and they regress. We don't want that, okay? Urinary infections, these kinds of things. And then Angie and I hear people tell us that Johnny never, ever gets sick, never gets sick. Everybody else was in bed with the flu, 2 weeks, thrown up, high fevers. Johnny got it over it in a day and a half, hardly batted an eye. The problem is Johnny gets exposed to all the same germs everybody else in the family does, and they set up shop inside his body and his brain. There's very good evidence that that's the case. And now a bunch of sleeping dogs that are really kind of gnawing away at the body are slowly kind of causing problems inside the body, and we need to eliminate these viral loads and things like that. We want autoimmunity, allergy, and this viral dormant load I talked about to get better. The goal, though, is at the bottom. We want our kids to speak. We want them to have improved GI function, these kinds of things. What about the pragmatics of this? This is a drug you get at the drugstore. It's not SCD legal for those who are interested in that because it has some cellulose in it and it's got some milk sugar in it. Why you'd put sugar in a diabetic pill if you're a drug company, I don't know, don't ask me, but that's what the packing agent is. The Lee Silsby Pharmacy, with whom we work very closely, there are many good pharmacies out there, they've made a transdermal form. They will make a transdermal form of this for the different kids. And Angie has brought up the point that if your kid has skin issues, sometimes we need to kind of gauge whether or not that's going to work. She can make comments about that. Let's talk about Avandia. Avandia is very similar to Actos, been around a little longer. It, too, is a diabetic medication that helps the immune system. It was in the news recently. How many people heard about this? All last week is all in the news. About how middle-aged diabetics supposedly have a 30% higher death rate from heart attacks if they take Avandia compared to other drugs, okay, for diabetes, okay, compared to other things. Dr. Nissen is a person I know in Cleveland. He's from Cleveland, and I know him. We've had mutual patients in my former life. And the basic thing is I gave him a call, and I'm sure he's a busy man. He hasn't returned the call. I told him I was giving a talk on some of these issues. And so I personally think that study, which is a meta-analysis, is something that I don't put a lot of stock into. I'm not saying we shouldn't look further into it, because he obviously feels very strongly that there's a heart attack risk for diabetics who take this, okay? Basically, the bottom line is I've gotten many calls from parents who are very concerned about the issue, and the study is a conglomerate of websites, non-published information, barroom gossip, trash cans, a bunch of stuff put into a computer, okay? And I'm being a little facetious, and it's easy to criticize research papers, but I think that it is not really hard science, not because we don't get criticized about those issues, but he's making it seem like it is, I must say that. So talk to your doctor, or if you're a patient of ours on Avandia, talk to us. I still believe it's a good drug, okay? If we have diabetics, we switch, and who have autism, we do switch them to one of these drugs. And there are various sizes and ways to ramp this up, but there are side effects, okay? Some kids have steady improvement, and they get better and better with neurologic issues, immune problems, and so on, okay? So if your child has that hidden viral thing that I think means they have a latent dormant virus in the brain, which a lot of our kids have, or if they have allergies and they're always rubbing at their face when they eat something, or when they lay on the carpet or play with the dog or something like that, or if their GI tract has yeast that the immune system just cannot get rid of on its own, those are the things we want to see get better. And some kids walk on water and they get better with that, okay? Probably 30 to 40% of them have something like that we can detect. There are some undesirable effects, okay? Anything strong enough to help our kids can cause side effects. I don't care if it's, some minor seeming treatment. It's not. Most of the time they're fairly mild because we slowly ramp up the dose. What do you expect? Well, if your immune system's waking up, you might get a little feverishness and look like you're coming down with something. If it's tolerable and mild, we ask you to ride through that, keep in touch with us. Sometimes you get this huge, what I call a viral upheaval. The security guard suddenly has eaten his Wheaties, goes around, kicks all the sleeping dogs, and now there's a huge upheaval in the body. High fever, regressive symptoms, meltdowns, cognitive issues, and so on. There's ways to deal with that, okay? And so usually we basically back off and start up slower. But it's a good thing when you open Pandora's box, because that means you've gotten your foot in the door and something was wrong there that you need to fix, and we're on the right track. I didn't mean for the whole thing to blow up and hit the ammo dump at one time, but that just means your child has a more massive response, and maybe there's more sleeping dogs there than we thought. Also, it is a diabetes medicine that seems, I was taught in medical school this type of thing would not lower your blood sugar, but Angie really brought it to my attention, and we were seeing cases where the kids who were skinny, taking the medication at night, not good eaters, maybe got sick, maybe got that little feverishness, didn't eat that day, took the medication, and for all intents and purposes looked like their blood sugar dropped. Sweaty, confused, not on their game, that kind of thing. So we have things in our protocol, taking it in the morning, making sure you're always eating, okay? And if they're throwing up, sometimes obviously we don't give them the medication. There is one case that we had that had some fluid retention, because it will make you hold on to water, and we have to watch for that. We had one child who seemed, after about a week, to have this back-wrenching, sort of uncomfortable feeling, intensely, screaming almost, and the mother didn't think he was in pain, but when she described it to me, I wondered if he had lactose intolerance and had crampiness or spasm or something. I couldn't tell. I don't know what that's from. She did not want to continue it, obviously. Let's talk about a couple other things. What about the cases that have those intense upheavals, okay? The foot in the door I talked about. We don't throw the baby out with the bathwater. I've never said that before, right? So I say that all the time. Sometimes we pulse the Actos, or we start it out slower so we can inch in, and you can knock off a few of those sleeping dogs a few dogs at a time, not all of them. You know, why let the whole kennel of snarling rabid dogs out at you all at one time, okay? So that's a newer thing we're doing with Actos. We're the only one in the country who's doing that. So I know that's a whirlwind about Actos. We'll have Q&A time at the end. Let's talk about something that sort of does and sort of doesn't get attention, and that's low-dose naltrexone. I think it's second line for Actos. I start with Actos or Avandia first. Low-dose naltrexone is a wonderful thing. We'll talk about how it works. I think it's very tricky to use, and I think you have to do it with a physician or someone very knowledgeable, because you can have problems with the dosing. Okay, where is this all working out? This has to do with endorphins, which is where the gluten-free, casein-free diet sort of, you know, fits into the picture. Endorphins are those good brain chemicals that are small protein fragments in the brain. If you look at that little sort of sea green R there, that's the piece of the brain that responds to endorphins, and it makes you have good ambition for life, and you're happy, and you also can talk properly and have correct interactions with people. That it turns out that endorphins are all over the body, and they help the immune system too. If you have low endorphins, then you don't have enough of that, and your immune system doesn't work well, you're not on your game, and so on and so forth. It turns out that the endorphins come along and plug in, like that yellow E, and turn on that receptor and make those things happen. Naltrexone actually blocks that and stops that from happening, and you'd think we wouldn't want to stop that from happening. But let's think about things. When your kid's on the GFCF diet, we're worried that they're getting these bad endorphin-like substances that are from gluten and casein, okay? And so from those dairy and wheat products in the body, once they enter, they mess with endorphins, okay? And they do the same thing on these receptors. They turn those receptors, but they turn them the wrong way. They may turn them off when they're supposed to be on, or they may make them too on. And what's too on? Stimming on a ball, okay? All the kids got their balloon or their ball at the party, but, you know, my little Daniel sometimes, you know, had just stimmed on it and not let it go and wants to take it to bed, take it to the therapist tomorrow, take it to dinner all week, you know, and now let it go. That's too much. They want something too much. And then turning things off, sleepy. And what if that happens in your GI tract? Constipated, okay, slow down, weak immune system, infections, autoimmunity, allergy. That's what happens in these situations, okay? And it's that same Th2, Th1 issue, all right? And then at the bottom, all these other illnesses that are driven by the immune system, okay? Inflammatory bowel disease, rheumatoid arthritis, asthma, lupus, okay? HIV obviously is something with the immune system. Okay, what if we give a low dose and block that receptor for a little period of time? The body says, I don't like this, okay? And it tries to make more endorphins. That's the idea behind this. And that just is a phenomenon that can happen in the body, okay? And so the idea is if we give a little bit, just enough to make the body say, hey, I want to make more endorphins to sort of compete with this naltrexone, and we give a small enough amount, a low dose, so that when that low dose wears off in a couple hours, if it's low enough to do all that, and that's where the trick is, okay, because it's different for every child, okay? And Angie will talk to you about receptors. She loves receptors and viruses, and she'll talk to you about those things sometime if you get time to discuss things with her. And you can figure out what happens. If you overshoot, okay, and block that receptor too much, then the endorphins can't work no matter how much your body makes. But if it's just right, and you just tweak that and tease that receptor a little bit, and the body makes huge amounts of the endorphins, then you can have good cognitive effects, GI effects, and immune effects. What's that? Oh, yeah, and Angie was discussing how that happens with other drugs with receptors, like Clomid for fertility issues.
Did any of you guys ever have any experience with Clomid, you know, when you're trying to conceive? You know how Clomid works? And it goes in and tricks the body into thinking it doesn't have enough estrogen, because a lot of these women are low in estrogen. So it tricks the woman's body into thinking that it doesn't have estrogen, so that the body will overproduce it. And if it works perfectly, they're able to have a good cycle that way. And LDN kind of works in that same fashion. You don't want the body to produce too much estrogen because it'll have negative side effects. But if you can get it just the right way, you can have some really good outcomes. That's kind of how that works.
And that's what we want to do. We want to find that perfect dose for your child. There are a couple of two different preparations. Oral, which in the real constipated GI kid, the constipated child, sometimes that direct application of it by taking it oral is really a good thing. If the kids have cramps or pain, or if they have constipation, because one other thing the endorphins do is they help prevent pain. And that's why you take things like morphine, which works on the endorphin receptors. So sometimes you get the kids to rise their endorphins. They have less pain in their GI tract. It's kind of nice if you do this orally. Most kids hate the taste of this, so it's very bitter unless they swallow capsules. So there is a transdermal form, okay? It's got to be given at night. which is a pain in the neck about LDN, because that's when this cycle of tweaking and pouring out endorphins happens. And so that's sort of an inconvenience. Sometimes you're dragging dog tired at the end of the day. Not that, any of us spectrum parents, my son's got autism, would know about that. But then, you get, Daniel to bed, and then you fall asleep and you forget, and then you wake up and it's 1 o'clock. Is it too late, to give it? So it's kind of a headache. But anything after 8:30 is fine with me. And so if you have a diarrheal child, though, I would definitely not do it orally. I would do it transdermal. What about the child that's not on the GFCF diet? And you give them naltrexone, okay? Then their endorphins rise, and then there's more endorphins to compete with the gluten and the casein fragments, okay? Because they all try to fight for that C-green receptor. Then all of a sudden, the gluten casein fragments that are doing bad things get blocked, and you're suddenly, as if you suddenly put your kid on a cold turkey GFCF diet. We've had kids that have had, sudden withdrawal. If you've ever kind of investigated that or did that with your own child, it's like putting your child in a drug withdrawal if you do the diet too fast. Naltrexone can have that problem. Furthermore, if you start off on naltrexone and you're not on the diet, and you got the right dose, and you work through all this, and what a headache, and we beat ourselves against the wall for weeks, and we got the right dose with Dr. DeMio and Angie, isn't this great? And we went through hell and back, pardon me, and then you go on the diet, it completely changes the dose sometimes of the amount that you need, because all these competing factors are at a different ratcheted amount, and it's very, very, very tricky, okay? It really, really is. It does some wonderful things, okay? But it can be very tricky. What are the good things? We want the 2 Bs, okay? If you're ever kind of up to your you-know-what in alligators and you wonder, how do I assess what it is that I'm looking for? The 2 Bs, the brain and the bowels, right? How's my kid's language? What's their behavior like? Are we getting good school reports? And how's their, eating, digestion, GI function, that kind of thing? Where are they at with that? That and the immune system in terms of obvious things like allergy and the amount of infections they get, and then those quote-unquote subtle things like these brain viral loads that we think are there. We want those things to improve directly clinically with your child. They should get better, okay? What about the side effects where they're in the same situations, the same areas of the body? So if your child gets constipated, if they start to have worse behavior that just keeps getting worse and worse or doesn't turn around, okay, especially if there's not a reason to believe that they're fighting an infection like a little bit of fever or something like that. If we think that it's just turning their brain endorphins the wrong way because you overshot the amount, because it's tricky, we start at a low dose and go up, then basically Houston, we have a problem, or whatever, that's when you call me. Now, we've had 2 kids, and this is what gives me really concern about LDN. Sometimes if you do overshoot that dose and your immune system gets weaker because you're blocking the endorphins continually, it's tricky, then the brain viruses, we've seen them, I think they've taken off twice in kids. And it's particularly kids that have high manganese, and there's a connection with that, and Parkinsonism and brain viruses, and the kids get tremorous. And we've had 1 girl that took 8 months to get over that side effect when I stopped the LDN. 8 months. How would you like to have that problem? You wouldn't. So it's like any other drug. It has its side effects. When it works, it's wonderful. But when it doesn't, it's a problem. We have to be very careful. So I developed an ultra-low dose protocol where you start so low that you sometimes put a little wisp of this on the skin that you can barely see and go up, and nothing happens in the beginning, and then you go and find the dose like a limbo game kind of going up. Let's talk for a minute now that we've done LDN, and we'll, again, if you have questions, we'll take them at the end. I have 1 slide on hyperbaric oxygen treatment. I mean, I know a lot of people have talked about hyperbaric oxygen. There was 1 panel up here, then there was 2 speakers giving some other discussions and research, then there was another speaker, and then the security guard gave a talk, and then the people at the desk were talking about it. So it helps the immune system. It helps the immune system, though, okay? Now, a year ago, I started talking about protecting the eyes when you go in the hyperbaric chamber, and now everyone's doing that at their centers, which is great. I think that's a good thing. And I start talking also about how hyperbaric's not just good for the brain, it's good for the GI tract, which other people obviously have started to mention, pretty much, and that's a good thing. Well, the immune system is big too. And we have several children at both of our places where the reason we're putting them in the chambers is because of frequent infections usually and autoimmunity. And one of the kids had surgery on the sinuses and all kinds of antibiotics and all these things, and absolutely nothing but hyperbaric with oxygen augmentation, which we're going to start with, has helped. So again, this slew of things up here that have to do with the immune system in autism and other disorders is what we use it for. And it's a broad stroke, and these are broad strokes we're talking about today. They don't just affect ear infections or stomach viruses. They affect your whole body because the immune system is very fundamental, isn't it? So hyperbaric, that's just another vote for it for many people. It's not for everybody, but for a lot. Let's talk about transdermal DMSA. And let me just tell you, I thought this was very important to talk about. I spoke about it last year. But I think people are hearing that it absolutely doesn't work and it's not something to be used for kids with autism. I think it's like anything else, okay? So in your garage, for you men, I'm going to use a man's example, although a lot of the ladies obviously do their own tool work and things like that. You have all these different tools. Every time you put in a screw or something, do you go get all the tools? You don't get all the tools, you just get one tool. This group, I must tell you, this group over here laughs at everything I say. Ready? See? I told you. I just said something and they laughed. See? See this group over here? Listen, you ladies, look at them. They're very serious. There's not a laugh. Well, now they're laughing. See, it's spreading. Everybody get up and do a wave, like, you know. Can you tell I'm from the 70s still? I'm sorry. I'm going to let Angie do a lot of the talking and buzz through this, okay? But DMSA transdermal is one of the tools we have. And it's a good tool, and it helps. It's a chelator, okay? And what is chelator? Okay, chelator is something that goes into the body as a natural substance or a drug, grabs onto metals like a pair of pliers, and when it's a bad metal, it can cart it out, okay? That's what we want, all right? Now, Boyd Haley did give a discussion that DMSA doesn't do that as well as some of the chelators he was talking about in a test tube, but it does do it, okay? He was talking about a big He-Man with two spikes picking up things from the side like that, okay? This is more like pliers kind of coming in and squeezing, and it does work, and it has other properties, okay? It can take a few months, as you're going to hear, or a couple of years. It's a big commitment sometimes and a longer process than just a few months. Why do we do it? Mercury is a big issue. I feel my son's brain and the brains of many of our kids have been badly damaged by the improper marketing and pushing and lobbying and use and medical school brainwashing and so on of vaccines, okay? And I think that that's just the case, and I'm not trying to get this into a political argument because I know we've all had to struggle with that. But the bottom line is mercury is an issue for most of our kids, okay? Also, it affects, look what it affects in the middle bullet there. Those are the same things we're talking about, brain, immune system, GI tract, okay? Forget the politics, no matter what the cause, our kids have problems with not just mercury, but lead, aluminum, thallium, okay? If you talk to Lois Smith, is Lois here? Lois, his daughter, has had, and then Angie can address antimony, okay, is another issue. Antimony, lead, arsenic, all these other metals, no matter what you think the cause is, are a problem for so many of our kids. And chelation helps to deal with that, all right? Bismuth, I mean, do you ever think your kid would have bismuth, all right? And when they're in the body together, they more than double their toxicity. It's not as if you have twice as much if you have 2 times the amounts, and it's not additive, it's synergistic, okay? If it weren't for the vaccine issue, though, and some dental issues, I don't think most of us would be here. I think it makes these other metals that we can get from pollution, okay, and other contamination, I think it makes them worse. So that's just my statement. As a doctor, it's important for me to know what the reason is that our kids got there, because that has everything to do with how to fix this whole thing. Well, basically, we do a history. We look over the laboratory tests. This is part of a whole program, all right? And there are many types of chelators, okay? Some of them have sulfur, some don't. Mercury loves sulfur, all right? And so there's a musical chairs dance. If it weren't for sulfur, the mercury that's in your child's brain and mine and whose ever kids have this, and I believe it's many of our kids, if not most, the mercury would never let go. I can show you chemical data that tells you it never would let go of a single sulfur atom in the form that mercury is present in the brains of our kids in one of our lifetimes. So how on earth do we get that out of the brain? You give the mercury another dance partner, another sulfur, okay? Nothing else but sulfur is going to free it up from the brain. I'm just going to tell you that. And when your body's healthy, it can detoxify with sulfur like glutathione and so on and so forth, okay? Why transdermal DMSA? Out of all the other chelators, there's DMPS, which we sometimes use. I don't just do this on everybody. I don't chelate everybody. I don't use this chelator on everybody. I don't use the transdermal form on everybody. But we use it on the right kids. So it saddens me to hear that there's this black and white statement that it doesn't work, okay? It works, okay? I said that on NBC when Angie and I and Scott were on, you know, and I'm saying it again today because it does work, okay? Many kids will not take it orally. Tastes like rotten eggs, okay? And it's less liver toxicity, which is basically nil. I can tell you I haven't had anybody who's had a liver problem of any significance with any of our chelators. Because we do it right, I think, is one reason. But I think that it's got less of a risk and less vomiting and things like that. It can stir up yeast. Yeast loves sugar, B vitamins, and it loves sulfur. loves sulfur, except sulfate. It doesn't like sulfate very much. So yeast can be kicked up, and it is a problem. And when that happens, we deal with it, and if we can't get rid of the yeast, sometimes we have to get rid of the DMSA to help control the yeast, okay? The transdermal form, and again, Angie has really kind of worked on ways to give this to kids, and in her child's case, you can give it at night when the child's asleep. If you want to go to these protocols every 4 hours, you can do that, okay? Use gloves when you put it on, especially the pregnant ladies. We had a woman ask about that earlier today. It does have a bad odor. You know, you can put it on the feet and wrap the socks over it. When there's a rash with it, which can happen with all the chelators, it can be from yeast, from metals moving around, any chelation. And these chelators come in various forms, rectal, drops, nasal, aerosolized, okay? We do have to follow up labs and watch the patient closely. And then there's a brain phase, because I don't believe that for most kids that the DMSA actually, and don't get discouraged by this, most of the chelators do not get into the brain, and alpha-lipoic acid, TTFD, and D-penicillamine and some other chelators will do it, but you have to be awful darn careful because some kids will get much worse, and you can bring mercury into the brain if you do this at the wrong time. So it's got to be done right, and the DMSA has to come first, and later your child may need alpha-lipoic, okay? It can be a big commitment, okay? And I think that it's time for Angie. Thank you.
Can you guys hear me on this okay? All right, I'm just gonna recap a little about, you know, what he just went through with you and just the way I see it as a parent. Basically, everything that he was talking about, we believe that the root of all of our kids' problems ties back to an immune system that is not doing what it's supposed to do and didn't do what it was supposed to do, in some cases from the very beginning, even before the child was born. So our goal as a practice when a child comes to us is to do everything we can to stop the assault, stop things that are assaulting the immune system and further damaging it. We also want to redirect the immune system so that it starts working properly. We want to repair it. So everything that he's talked to you about today is trying to perform those sort of tasks. Things that are assaulting our immune system and have assaulted the immune system of our children is metals. Metals assault the immune system. They shut it down. Fungal issues. 70% of your immune system is in your gut. I don't know if you guys have watched those Dannon Proactive commercials on TV, but it's true. 70% of the immune system is in the gut. And what do our kids' guts look like? They're horrible. So we have to find ways to heal the gut. Viruses. A lot of our kids' immune systems are so defective that when a virus comes along, it moves right in and continues to do further damage in the immune system. So we have to find ways to control those viruses and hopefully eradicate them, get them out of the body, let them stop attacking the body. Allergies. You know, allergies are a product of a defective immune system. It didn't do the right thing and it formed an allergy. But after the allergies are formed, if they continue to be introduced to that allergen, it continues to attack the immune system because the immune system is so busy fighting off all those allergens that it's not going off and fighting off viruses and other things it needs to be doing, like detoxifying the body, which a lot of our children, it just didn't work that way for them. Toxins. You know, we're exposed to them every day. They're surrounding us in our environment. They're in the children's vaccines. They're in a lot of the food that we put in our mouths. So what we want to try to do is cut down on as many toxins as we can that are around our children so that it can give the immune system a break so that it can get back to doing what it needs to do. He talked to you today about Actos, LDN, and hyperbaric oxygen therapy. These things are used to redirect the immune system. Like he said, in our kids, we usually see one of three things. The immune system is completely asleep. It's been attacked and assaulted so many times that it's just lying there and letting anything take the body over. So in those cases, we need to wake the immune system up so they can see what's going on around it, find the viruses, find the metal, and start trying to get them out of the body. The other thing that we had talked about was things like Actos and LDN. They would take an immune system that is firing at everything. You know, you have an immune system, instead of firing at viruses, instead of detoxifying itself, it's firing at things like grass and dogs and cats and everything it can find. It's shooting like this. And what you need to do is you take something like LDN or Actos, it'll go in there and say, okay, everybody straighten up and start firing at the right things. And that's why he brings those kind of medications to the forefront, because we need to teach the immune system how to shoot at things it needs to shoot at to take the strain off of our children's bodies. Hyperbaric oxygen therapy, it wakes the immune system up. What it does, and I'm sure you guys learned about this from the talks, is it helps reoxygenate the white blood cells. And white blood cells are necessary to fight for our bodies and get our immune systems working. So hyperbarics can be used to try to get those white blood cells strong enough so they can go and do their job. In addition, it also has gut healing properties about it. And as again, I'd mentioned, 70% of your immune system is in your intestines, it's in your gut. So hyperbaric's going to really help from that fashion as well. I'm going to talk to you a little bit about chelation. There are several different chelators out there, and no one chelator is the perfect chelator for every child. There's many different ways to administer chelation, and there's many different agents to use. It really depends on your child. It depends on how many metals they have and which kind of metals seem to be the worst problem. Transdermal DMSA is obviously in a transdermal form, and for some children that's the right way to go. If you have a child with really, really bad malabsorption issues and they're just not taking things in when you put them in the body orally, sometimes the transdermal route might be a better way to go for that child. Also, it surpasses the gut. So sometimes when you put an oral chelator through the gut and it just really causes them a lot of gut problems, sometimes you can avoid that by going with a transdermal chelator. DMSA. DMSA is very well known, particularly for getting lead out of the body. And I look at the metals in the body as being like this big glass jar. You know, you've got all these metals in the glass jar. Mercury is the most adhesive metal in your body. It's the strongest. It has the hardest hold. So if you looked at a glass jar and there was a bunch of metals stacked up in there, say we'll put that in the form of paper clips and other kind of magnetic things, mercury would be at the bottom, and it would be the heaviest thing. So sometimes you have to get a chelator that goes and pulls all the paper clips and stuff on the top out of there so that you can get to that thing on the bottom and pull it out of the body. If you have a bunch of lead in the body, and there's also mercury there, but there's a ton of lead, and there's a ton of other metals that DMSA might pull out, sometimes you can use DMSA first to go and get those other metals out of the body, but it also chelates mercury, so sometimes that can be a really good choice for a child. If you have a child that's not necessarily high in lead, or some of those, and is just high in mercury, you might pick another chelator just for that particular case, like DMPS, or something else that chelates mercury. But in some kids, DMSA can be a really good choice. For my son, it was a miracle. As far as a problem with using a transdermal chelator, if you have a child that has a really thick epidermis, I've seen kids where you rub something on them, you know, a shiny type of cream, and you look at them an hour later and it's still shiny. That cream is not absorbing into that kid's body. That kid may not be the best candidate for a transdermal chelator. So that could be a problem. Or you have a kid that absolutely never sweats, you know. They might have a really thick epidermis, you know, and that's something you'd need to address first, you know, maybe with sauna therapy or something to get the child's body to start regulating and sweating. And then a transdermal thing might work better on that child. For my child, we video documented the use of transdermal DMSA as a chelator. We taped him the night before chelation, and I'm going to show you a video of that, documenting that. And then we taped him again 4.5 months later and 5.5 months later. Transdermal DMSA was the only biomedical intervention we gave my child during the time we made these films. We did not do any other types of biomedical interventions other than your basic vitamin and mineral supplementation, you know, to keep his vitamin and minerals up while we were chelating. And we did not do any behavioral therapy at all. This chelation therapy was done over the course of a summer, and my child was not in any kind of programs. He was home with me. So hopefully this will show you a case where with my child, transdermal DMSA was a good chelator. And at least will keep you open-minded to look at all the options when you're looking into chelation for your child. This is not coming out. Yep. It's not coming up. Here we go.
This is Joshua. He is over 3 years old. Today is, what's today? Today is June 2nd, and he has been diagnosed with autism. We have been going through a biomedical approach with him. He has just completed allergy treatments. What'd you say? What?
The
would say Daniel significantly recovered, but we're about halfway through our journey, and we're still working on it. And he wouldn't eat, he had a feeding tube, those of you who may have known about that, and just couldn't go out really to do anything. We just have all these sensory issues on the beach and so forth and so on. So you can see he's a pretty happy kid, and he was balding and losing weight and just not even strong enough to walk around the whole day. Really.
I wanted to recap, too. I had said there was 3 different types of immune systems, and I mentioned 2 of them. I didn't mention the third, and he'd mentioned them to you. You got the first one where the immune system's completely asleep. It's just overtaxed and doing nothing. You had the second one where it's firing at everything and building tons of allergies for your kid. And the third one, again, was where it's totally declaring mutiny on itself, and it's just completely destroying the child. You guys hear about that myelin sheath? You know, where the myelin sheath's being attacked in the brain? That's the body completely attacking itself. You know, it's destroying itself. You see a lot of these poor little kids that are banging their heads against the wall all the time and things like that. A lot of these kids need something to do remyelination for them, to get it to stop. Actos can be very effective for that. So, you know, that's one of the things that Actos got brought to the forefront for. It can actually stop that attack on the myelin sheath. There's a very intense procedure that kids can have done, you know, an IV procedure. I don't know if you're familiar with that, where you have to go and get a $30,000 IV procedure to stop the myelin sheath from being attacked. Sometimes you can forego that very intense procedure and you can try Actos, and it's a lot less intense of an option for your child. So I've seen it brought in for that purpose as well. So, sorry, I wanted to clarify that. Myelin, M-Y-E-L-I-N, isn't it? Spelling bee.
That's the coating around the nerves and the wiring in the brain and the spinal cord, and it insulates and it times how fast the signals go so that they arrive, 2 different signals arrive at the same place at the right time.
Why is it acting so way?
In tandem and not at the same time where they collide and so on. So if you're stringing a sentence together, you know, the first word and the last word have to be timed, and so myelin's important for that. It's important for sensory integration. And mercury getting into the myelin sheath will cause the immune system to attack it. It can poison the myelin, and you get antibodies that are the bullets and the harpoons of the immune system attacking the myelin. The myelin is like scraping the insulation off the wire, and then the wire can short circuit. It can literally short circuit or conduct the wrong way, too slow usually. And there's inflammation there. There can be pain and headaches, and your child can be very touchy, and every time that nerve gets touched, it fires off, or it won't fire enough, and so they don't feel things enough, and they gouge their eyes because they want to feel it, and they want to hear things, or they don't want to because they're sensory defensive, and it just messes everything up generally. And then when you talk about brain, you know, tracks, there's fibers in the brain. You can't talk, can't think, you know, attentiveness, that kind of thing.
Does myelin regenerate, or do we create new neural pathways?
The question is, does myelin regenerate, or do we recreate new neural pathways? There's some of both. And the myelin, when you heal, the myelin is this sort of, it's like an octopus that wraps its tentacle around like a jelly roll and kind of curls it, or like a monkey with its tail around the little branches and it curls it, and that's the insulation. And so the myelin can heal and regenerate because if it's trying to heal all the time and it keeps getting scraped off, it ain't never there.
Would your computer be
If it
better?
stops getting scraped off because you help the immune system, then it can grow back on. It often takes 6 to 9 months. Some kids seem to do it faster than that. Then new neural pathways, where you just use a different mechanism in your brain, just like a stroke patient who may sort of learn how to walk a little different and pull their words up a little differently. And so our kids end up doing both. And they have some recovery and brain improvement.
On this video you're about to see, in part 1, when you see Joshua, he was pretty much non-responsive. He did not have relationships with his family. He had a couple of words. He had no purposeful language at all. We had no two-way communication with Joshua at all at that time. You'll see he had a lot of self-stimulatory behavior. He was autistic, and he was in his own world. And you'll notice when you go on to part 2, the difference in his ability to have a two-way conversation. Prior in part 1, he did not know how to point, wave, say hi, bye, mommy, daddy. You're going to see all of that within 4.5 months. So, and look at it as what chelation can do. We talked about transdermal DMSA, but I really want you just to focus on the chelation aspect of this. This is what chelation did for our child.
Is it when you start DMSA or whatever?
Why don't you come to the microphone? Just come up to the microphone. Go ahead. Don't be shy. Is it on? Check and see if it's on. There must be a switch.
No, it's not.
Well, just yell. Use the Italian intercom and yell.
My question is, if you choose to chelate a child and you do a challenge test to find out, is this chelation working for my child?
Mhm.
Is it normal protocol to do a challenge test after a week of starting chelation, or is that
I
not
wouldn't.
even enough time to pull metals?
I wouldn't.
Because we did that route and then didn't pull any metals according to the labs that came back. Yet, I'm wondering, how is it in 1 week, in such a short amount of time, can you really pull metals if in fact mercury's at the bottom, although she's not very high in that, she's more high in aluminum, but supposedly nothing came in your lab part. Would you challenge test a child that soon?
It's up to you. You can answer it. I think, I think that every doctor that is guiding you is going to have a different opinion as to when they want to do, a test to see how a chelator is working. Personally, I think that 1 week is very early on to try to challenge test a child. Again, it's going to be up to the doctor. But, you don't know how adhesive the metals are in a particular child's body. You don't know how well a child's able to detoxify. There's 3 different detoxification pathways. There's sweating, urine, and fecal. And, depending on how well your child is able to release metal and detoxify it from their body, I think that early on it might be kind of premature to go ahead and see what they've pulled out into the pathways and released from the body. That's just my personal opinion. Do you want to add to that?
Well, yeah, we generally haven't done challenges until the end, really. The idea of a challenge is that you give extra doses, or during the time you have a chelator running through the body, you see if a lot of mercury gets pulled out, or lead or something, usually mercury, to quote-unquote see if there is a bunch of mercury in your kid's body. And that's the idea, that you do that. Now, some kids will respond by starting to have a rise in mercury, so you do a test before and a test after, and find out if there's a rise. And supposedly that gives you this tremendous insight, and I don't want to sound like a smart aleck and critical, but supposedly it gives you this wonderful insight to see if chelation is going to help your kid. Well, the idea of it is our kids are poor detoxifiers. The mercury is deeply buried. They don't have it out in the open. They have trash in the house. They don't bring it down the driveway so the garbage man can pick it up. So when you do blood tests, hair analysis, our kids have mercury that's lower. They have lead that's lower. And the fact that the aluminum's higher means that she's better at getting that out in the open, and probably has a huge burden, and there's various interpretations. But if the challenge is only going to bring you up a notch, and that notch isn't enough to bring it out in the open, then you're going to have to go for months and months until you're able to tell, and sometimes it does take months.
It can. And like that, I think you can get too wrapped up in what's on the paper, too. Don't get so wrapped up in what's on the paper in the beginning. Start watching your kid. Pay attention to what your kid's doing and how your kid's acting. And you also need to know enough about it to know that, sometimes when you start pulling metals, things can look worse before they look better. The metals have a lot to do with how your kid got this way in the first place. So they cause a lot of unusual behaviors, and when you go rattling them up and pulling them out into pathways, you might see some increased metals behaviors. And like he'd said as well, the metals and the yeast have a really nice partnership. And if the metals have been embedded and hidden for a long time, and you start pulling them out into the site, the yeast is going to flare, because yeast is a bad guy, but the reason it's there is it's the body's attempt to protect itself from metal. So when it sees an enemy, metal, the yeast flares up to try to form a billowy cloud to prevent the metal from getting into the body, and then you have to deal with that problem as well, and that can make things look worse before they get better. So you need to keep that in mind. In the midst of all that worse behavior, you need to start watching for improvements. You can't be too obsessed with the bad behaviors that you see. You might see something cognitive thrown in there as well. Really helps to watch your kid. And also remember, when you go to testing for this stuff, some kids are urine excretors, some kids are fecal excretors. I've seen some urine tests, hardly any metal at all, and the same day a fecal test was drawn, there's metals off the chart. What if you'd only done one? What if you'd only done urine? Where might you have been that day? And then there's some kids, they don't excrete anything in the fecal, and they excrete everything in the urine. So you do need to keep that in mind as you're testing as well. And you need to be patient. I wouldn't give up on a chelator in a week. I'd give it a little bit of time to work. And then, you need to give yourself a time limit. You need to work that out with your doctor that's guiding you. And if that particular chelator doesn't work with you, or
This
that
is
particular
Joshua.
administration.
He is over 3 years old. Today is, what's today? Today is June 2nd, and he has been diagnosed with autism. We have been going through a biomedical approach with him. He has just completed allergy treatment. What'd you say? What? Really? What else? Okay, you're making me dizzy. Hey, Joshua. Joshua. Come here, buddy. Joshua, come here, buddy. Are you getting tired yet? Oh, there goes the eyes roll back. There he goes. He's rolling his eyes and his head spinning around. Yeah, we like this, don't we, huh? Well, you're going to make yourself dizzy and you're going to fall down again. Hey, Joshua, do you want to say something for the camera? Come here. Joshua. Hey, Joshua. Come here. Do you want to say something for the camera? Come here, buddy. Joshy. Come here, Joshy. Come to Daddy. It's like I'm not even in the room sometimes.
Okay, this is my camera.
No, this is my camera.
Where's my camera?
I don't think so.
My camera.
No, this is Mommy and Daddy's camera.
Mommy, and go with Mommy.
What, honey?
Look at have
Can you have? You want my camera?
mine.
No.
It's mine.
It's mine.
Get that. Get that.
Give it up.
Yeah. Get that. Get that. Get that.
Look at that transformer.
Get that.
Are you getting up now? Uh-oh. 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 No, 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 no. Don't come after me. Help, help, help. Uh-oh. No. You can't have it. You can't have it. You can't have it. I'm going to tickle you. You better watch out. Watch out for the tickle monster.
My camera.
You really want this camera? You want this?
Get it,
There I am. Do you want this camera? Do you want it?
yeah. A
Oh.
camera.
Well, look, let me show you something, okay? Look at this. Who's that?
See?
Who do you see there?
Joshua.
That's right. You can see yourself, can't you?
Even me. What can I say?
Okay.
Even open it.
Oh, what happened?
Open it.
Open it. Okay. Oh, I'm sorry. I didn't mean to close it. Let's see.
Joshua.
Yeah, there's another picture of Joshua.
See.
Say hi to him.
Hi.
Do you like his brown shirt?
Yeah.
What's the matter?
It's dog.
You're stuck. What do you need?
But help
Some help?
with the help.
Okay. Here, I'll help you.
Help you.
Oh, here we go. Oh, goodness. Okay.
Oh no.
Oh,
Okay.
oh no, the gate fell down. You gonna fix it? Oh, thank you. I appreciate your help.
Simon says, touch your ears. Good job. Simon says, touch your toes. Good job. Simon says, point to the star on the top of the tree. Oh, there's the star. Okay, Simon says, touch your knees. Oh, good job. Simon says, touch the top of your head. Good job.
Oh. Okay. 1, 2, 3, 4, 5, 6, 4. Okay. 1, 2, 3, 4. Okay, Josh's turn. Okay. 3. Okay. Like that's good. Ready, set, go. 1. Okay. No, there's no C. Josh's turn.
Didn't get a 2.
Okay, Josh's turn.
I'm like,
I just always appreciate and thank Angie for sharing that with us, because it's obviously very personal. It's her child, and she really wants to help everybody by just letting things speak for themselves. And this is during a time when there was no change in therapy other than just the DMSA and with glutathione, and it was transdermal, and they're still on the waiting list for ABA at a certain institution, and I'm kidding, I had to throw that in there. And it just is very dramatic. I mean, it really, really is. And there just isn't any way to argue with that, I don't think. I just really, and Angie can talk to you about how some of these kids, you won't see mercury for months and months, you know. You'll see antimony's a big one that she knows a lot about, and other metals and so on. So let's open up the floor, and people can come on up, and we're going to repeat questions so the webcast, listeners can also hear us, because they're hearing just from the mics. So any comments, questions, your own experiences, other chelators, Actos, Avandia, immune system, and if someone knows how to turn those mics on, wonderful.
This one's on, is it?
Go ahead, you sir.
Okay, I have a question about Actos.
Yes.
Because some of the side effects of Actos are similar to those with hypoglycemia, I wanted to ask you about them, because
Yeah, they seem to be, yeah.
we actually started our son on Actos and pulled him off of it. We started him on 7.5 mgs in the morning, and then when he got up to, and he had some side effects, but it was okay. When he got up to 15, then it got a little bit more severe in terms of irritability, tantrums, his speech started to decline. He had this thing where he started to cry for no reason, where he would just even tell himself, don't cry, and then start to cry.
Yes, right, he feels it coming on.
And so when we looked up hypoglycemia and some of those effects, we saw that. So the challenge for us was knowing, is this a normal effect of Actos working, or is it hypoglycemia that we should be worried about? So
how much does he weigh?
About 34 pounds.
Yeah, so you're up to 15 milligrams and you're getting that, correct?
We at 15, and then it would sort of plateau, and then it would come back again. So it got inconsistent. He wasn't consistently well at any point.
So the symptoms never quite were absent on some days, in other words.
Yeah.
So they're there some of the time. And how's he eating, and what time of day are you giving it?
We were giving it to him at breakfast and making
With
sure
food.
that he gets protein, not just carbs with it. So.
Okay, yeah. My first approach to that usually is that you can get yeast die-off and some other, and viral situations have a die-off-like reaction too, and you can have those. And if it goes on for something short of 2.5-ish weeks and it's tolerable, I think oftentimes I'll ride through that. If there are outright meltdowns that are just really, really difficult, or it's too hard for the family to handle those. Is it coming with fever at all, or anything that makes it look like he's got down with an infection, or any GI symptoms?
Yeah, there was a slight fever, nasal congestion. So.
Yeah, so those are clues that lean me toward thinking that it's more that the immune system is kicking the sleeping dogs. Okay, and so I tend to want to ride those out, and sometimes you'll kick the dog with one foot at 7.5 or 15 milligrams, and you may need to get up to 3/4 of a tablet or a whole tablet. Are they 30 milligram tablets? Is that what you have?
Yeah, I think we were 7.5. They were probably 15 milligram tablets.
15 milligram tablets. Okay, yeah. So I mean, you always want to know how many milligrams, because there's 2 sizes, 3 sizes of tablets.
Right.
I take the 45 milligram tablet myself for immune reasons, and I can't break those up for when we give them to my son and that kind of thing, because they're too confusing. So. The bottom line is that with the nasal symptoms and the feverishness, that would tend to be more along the lines of either GI or kind of clearing viruses and so on. Now, sometimes you'll institute treatments that may, like antivirals like olive leaf extract and some other things, if the Actos doesn't kind of finish the job. and finish off the dragon or whatever after you get up to whatever dose that you're titrating up to. Other times in the GI tract, for example, you may need to add or change your yeast treatments or whatever dietary intervention you're doing so that those things that may not have worked will work better with the Actos, but the Actos can't do it alone, you know what I'm saying? So those are the things that come through my mind. But it's a straightforward thing to either get a glucometer or to go to the hospital and get 1 or 2 time blood counts. And what we happen to do a couple of times is measure amino acids and sugar, and sometimes the amino acids are way off in the kids that have a metabolic hypoglycemia-like reaction. And when they're having that reaction, they don't have to be fasting, because if the Actos is making them use amino acids or sugar in a way that gives them that kind of symptom, you can check and see. And sometimes you need to have a baseline of both of those.
So that's going to tell us whether or not it's hypoglycemia, whether it is.
Well, yeah, but I'll tell you, we've had 2 or 3 kids where they have had a situation where we happen to either luckily get blood counts at a time when they had a reaction like that, or they went ahead and got the test while they were having that reaction. And the sugar doesn't change that much, but the internal mechanisms of how the cell is driven to use calories is what Actos does, and it does that same thing inside white blood cells to help the immune system. And so sometimes giving a meal, I mean, does it help to give your child something to eat? That's the classic.
Yeah.
Yeah, now that makes me go back the other way then, if the symptoms go away when you get protein or carb. And so sometimes you have to adjust the dose.
So he craves, then we give him fruit, bananas, he craves that sort of thing.
Yeah, that sometimes means you've got to break it up in small amounts during the day. Sometimes you'll get around that kind of reaction. So the total dose can affect the immune system without affecting the metabolism all at once.
Okay.
So there's various ways to deal with that, and I would consider, the possibility of blood counts and check in with, the office about doing that.
Okay, thanks.
Thank you. The gentleman over here.
Hi, doctor. This is a question from the web. I was wondering if you could elaborate a little bit on protecting the eyes in the HBOT.
Yeah, Angie and I use the question, for somebody listening on the webcast, elaborating on protecting the eyes for HBOT and the chamber for hyperbaric. Well, anybody who's on oxygen long enough is going to have more exposure to the cornea and the retina of oxygen. Little babies in the ICU, people with emphysema with these nasal prongs. When it's at pressures that are higher, we can use less oxygen, meaning we don't have to use as high an oxygen as you might have an effect with if you're like at an oxygen bar or you're just using it at atmospheric pressure. But I've been a stickler for over a year about wanting to protect the eyes. So we use a carotene, which a lot of the kids can do that if they're on cod liver oil, or vitamin A of some kind, and a couple of the antioxidant minerals, namely zinc and selenium. And then we also use a variety of other antioxidants, and many of the kids are already on a lot of these things. And we generally have a chaperone go in with the kids, meaning usually a parent or someone else who ahead of time is designated and who's scheduled for that appointment to go in, and we want them on something that's either those same things or something similar, and then depending on what their health issues are, we might adjust those. So that's basically what we do. Angie has.
Yeah, when you're looking at the body and you look at the eyes, you have blood flow and oxygen to air different areas of the body. One of the places that is really intense already is behind the retinas and the eyes. There's already a lot of blood flow and oxygen to that area. So when you take somebody and you put them in the chamber and you increase pressure, it's going to be a lot of blood flow and oxygen right to that part of the eyes, and you want the eyes to be strong, to be able to handle that kind of intense blood flow and oxygen to that area. So that's why we want to give them something to strengthen and protect the retinas, protect the eyes, so that they can better, handle that, and there is no negative side effects from that. So that's really the purpose for giving supplements for the eyes. Either, like you talked about, vitamin A, beta-carotene, and also some people can use lutein if they have problems with cod liver oil, for various reasons. We'll just do things that we can to protect the eyes and strengthen the retinas. So that's why we do that.
Do you want to take the next question?
My question is about ALA. My daughter's been chelating for almost 2 years now. We started with transdermal DMPS. We've moved on to IV DMPS, IV EDTA, and IV glutathione. We just added phosphatidylcholine. She's made some improvements in a lot of areas, still no language. Wondering if we haven't attacked any of the metals that are trapped in her brain, and if we went to ALA, would that, and if we did do ALA, what is the protocol for that? I mean, is it a once-a-day dose? Is it every 8 hours? I mean, what is the normal to get the mercury out of the brain?
Also, have you done any type of therapy that would, is your child possibly a viral kid, just out of curiosity?
That's, I think I'm going to be testing for that now.
Okay.
I know her immune system is overactive
Right.
because she never gets sick, and when
Right.
she had a fever this year for the first time in years, she was the calmest I've ever seen. She watched TV and didn't move, and we all just thought, well, she's sick and not feeling well, so, but now I'm thinking, my God, maybe because the fever attacked the virus or something, maybe she's calming down.
Yeah, sometimes, I mean, I just personally believe this, and there's others who believe it too, there's a relationship between metal and viruses. And they can kind of cling to each other. They can kind of hold on to each other. You know, if you've been chelating for a while and you've been pulling a lot of metal out there, there's a possibility, in my opinion, that if you have a really viral kid and you have not done anything to try to eliminate viruses from the body yet, the eliminating of those viruses, first of all, is going to help reduce certain behaviors in your child that may look autistic. Additionally, once you get them out, I've seen many cases where as soon as the viruses have been eradicated or several of them removed, metals start dumping because they were holding on to a lot of the viruses can actually get embedded in the body as well. And if you can release that, it can free up more metals to come out. That's a possibility right there. And that, you are absolutely right. There is also metal that is stored, you know, at the stem of the brain. And often it does take a chelator that can go up through the blood-brain barrier and pull that amount of metal out of there. Some believe it's a good idea to try to make sure you've gotten as much body burden metal out of the body first, so that when a chelator goes in there, it doesn't carry any bad guys with it when it goes up, because the brain can be kind of like a revolving door, you know, in some kids. So you obviously don't want to take stuff and redeposit it in the brain. That goes against what you're trying to do. But there are many cases where people have to add ALA towards the end of chelation for a while to go up and get that amount of metal out of the brain. So it could be both of those things or one of those things. Or
She's still pulling a lot of lead.
Yeah.
In the past year, it's been nothing but lead. For a while, there was a lot of aluminum and
Right.
arsenic.
Right. Well,
Aluminum and
those
arsenic.
metals, like we kind of thought, could be actually, you know, also interfering with, you know, maybe pulling some of that mercury out too, and maybe still working so hard on getting those ones out of the way. Again, there's no way of definitely knowing that, but that is a possibility as well. And the fact that she's still pulling metals is a really good thing.
Okay.
You got to get them out of there. No matter which metal it is, it needs to get out. You know, so you're definitely still going in the right direction.
Would you suggest ALA if I was going to go that route, like a once-a-day dose every day? Is that?
ALA is tricky because you have to be patient, and some kids will not have a negative reaction when you add the ALA, quote unquote, early. But if there's a lot of metals still below the neck, okay, and you add the ALA, it's going to load up on those metals before it gets in the brain and dump them off there, and you do not want that, particularly mercury. So it takes a lot of patience. On the other hand, some kids don't end up seeming for some reason to do that. However, my policy is you absolutely do not give ALA unless you have another chelator on board, because you want the ALA to be empty before it goes into your brain, and the other chelators generally are stronger. They'll strip anything the ALA's picked up as it bumps along the hallway that's dirty before it goes up to the living room, all right, in the brain. And you want the ALA to be empty, to load up and come out and dump it off, and then do a round robin and go back in and do the same thing. And if the other chelators are stronger, it'll strip that stuff off the ALA and send it back in to go in and get some more. And that's what you want to do. So on the other hand, sometimes you're sitting there for years and years, and if the mercury's gone low then enough, then sometimes, unless the other metals are horrendously high, you can go ahead and do a trial for a couple of doses of ALA. Do it when you're giving the other chelator, not a day you're not. And I start it once a day. I do the transdermal because, boy, if you think DMSA kicks up yeast, alpha-lipoic does a lot more. It's a B vitamin and sulfur. But some kids don't get yeast with it. I've got some kids that get more yeast from the chelators than they do from the ALA. And so I think that you don't go for weeks and weeks and weeks if it's causing any regression. That's a sign that you're bringing something in.
Another thing about ALA, too, that I had read recently is that I'd read that ALA can inhibit the excretion of copper. So if you happen to have a really high copper kid, it would be probably in your best interest to try to get copper levels down before administering ALA. I would definitely watch for that because you know how agitated kids can get when they're high copper. If your kid's a really low zinc kid and they just cannot seem to absorb zinc, they can't keep zinc, copper and zinc can tend to have the seesaw relationship. So if your zinc is always down here, there's a possibility that your copper could be up here, and you go and give them ALA and it prevents the excretion of it. You could end up with a really agitated kid. So you'd want to be very careful about that as well when considering that particular chelator.
Thank you.
The gentleman over here.
Yeah, my question was that that was, I mean, just amazing the results that she got within a few months. My question is that for chelation, I've heard stories, well, like yours was like a very quick chelation, and then I've heard other people that have gone for years and really haven't seen any dramatic results. I mean, what determines if you're going to have like a really good outcome, an average outcome, or whatever it may be?
Well, you want me to answer, you want to answer?
Go ahead.
I think chelation is just one part, in biomedical interventions. There's so many different pieces there. We've got to remineralize and get vitamins and minerals back in our kids because they're totally malnourished. A lot of times our kids are full of viruses. Our kids' guts are really, really sick, and we've got to heal them. A lot of our kids have massive inflammation in their brains, and we've got to find a way to get that inflammation down and get blood flow and oxygen back to their brain and wake up some sleeping neurons. Chelation is another one. You got to get the metals out. I look at all of our kids as being like little jigsaw puzzles, and each one of those types of therapy is a puzzle piece. And sometimes if you pull a particular piece out, say chelation or something, and it's not in the right order for that kid, sometimes you've got to put that back in the box and pull something else out and do some other changes first. And then you can go back and pull it out and it might work better. Some people are so blessed in that the first puzzle piece they pull out is the magic bullet and everything falls into place after that. Others, the way their child's body is done, because no kid's the same. They've all been affected differently. They've all been assaulted differently, and their chemistries are totally different on the inside. So, I hate to say it, but it really, in many cases, it's the luck of the draw. When you pull something out, if it's not the magic bullet, you may have to put it back and work on something else. Then once you find something that fits, you can build on that. You've got a plan and you've got a way, and you can start building on that, once you start seeing some gains with one particular thing. Not only that, the whole way along in this journey, it's constantly digging for and trying to find answers. And once you find more answers, you're better able to see what works. So there's no guarantee as to how fast a kid's going to respond. And a lot of times it takes a lot of different things to try before, and you find that one magic bullet for that kid. So I guess to answer your question, from me, it would be very hard to determine how they're going to respond. You can look at the overall response rate to chelation. If you look at the ARI results, it is the highest responsive intervention there is in the biomedical treatment of autism. I think it's like 78% good response rate. So it is the highest rated intervention as far as beneficial results. But there are so many others that are important. So did you want to?
Well, yeah, and Angie also brought up the point that, we do testing to try to see if we think it's better. And the history, if your child has all these immunologic problems, we might start with Actos first, or OLE, or just getting your kid healthy and trying to get the GI tract under some control. Let's face it, if we gave the kids a probiotic and some antivirals and some decent levels of minerals, some kids will have tremendous improvements with that. And if any one particular thing really moved your child in one direction, you might not have to go to another puzzle piece. But sometimes chelation will not work well unless you do HBOT or do something to energize the cells to get rid of, the cells do the job. I mean, it's like any other medical treatment. We're not doing the work. The cells get a little bit of help from what we do. And so HBOT, for example, can vasodilate. It increases the blood flow to the brain where mercury may not come out with DMSA, but cadmium and arsenic and lead can be pulled from the brain while the DMSA bathes the blood vessels and so on. That can work that way. So if that blood vessel is tight and constricted, HBOT can reverse that constriction and allow the DMSA to get up there, and some of your B vitamins and some of the zinc you're giving and all those other things. Does the same thing in the gut. So sometimes you'll pick things up here and dump them off in the gut, and your chelation or your antivirals will work better. And if you do an antiviral, sometimes that'll help the chelation and vice versa. Some kids, absolutely nothing goes in the right direction until they get chelated, and other kids, the chelation, like Angie said, either you may pull back on it and do it later or add something else so it's a better treatment. Just like if your gas tank's full and everything's going, how come we're not going anywhere? You don't have any tires. Sometimes you have to do that. So, we have a web question?
Yeah, just another web question. You had mentioned DMSA with glutathione. What type of glutathione?
I use them separately. We use the transdermal form usually, but it comes in an aerosol as well. There is the lipoceutical swallowed form, which may be absorbed on the way down through the esophagus before it hits the stomach, and it may not. That's the intent of it. But if it doesn't, it can cause yeast because then you're in the GI tract with glutathione. But glutathione is the body's natural chelator, and so it helps recharge the DMSA, and it in itself also can help the chelation process at the cell level. And it's a natural detoxifier for pesticides and a number of other things too. So we are... so we are always adding, we're always adding the glutathione, but some kids can't tolerate that, so we almost always add it in the beginning, and that's what we do. Gary, did you have a question? We can take your last question. Do you have? Can you do it on the microphone so the web people can hear?
My question was, I heard from a couple different people this week where they said sometimes the children whose heads grow really fast in the first 6 months of life, like he's worn the same hat size as I have since 6 months. And that those kids are usually the harder nuts to crack. Have you found that to be true, or?
I think that there is, the information that the kids have, our kids may have on an average a larger head, and I think if you find any particular trend or physical finding or laboratory abnormality in any given patient that is a marker for that disease, even though it might be some time or only 30% of the time, that the more of those markers you have for a child, then the more intense a case you have. And certainly we know your son, and you've been working on him a long time, and we have too. And my son's got some of those characteristics, and I think he's got a more severe case. So I think that yeah, but that gives me no hesitance to go ahead with any of the treatments that we have that we know help the kids. Sometimes they need to use them for longer times, and we need to turn the heat up. We need to use more treatments. And so we just keep going until we're sure that there's nothing else we can offer, which I don't think we've ever said. I think we try, and then there are the kids with big heads that don't have autism, and don't have developmental problems. So the issues are that doesn't speak to the lack of response or anything to me. I think that was your question.
Yeah.
Okay. Thank you very much. You've done a great job going through the whole conference, and I appreciate your attention. Thank you.